Every year, about 800,000 people globally die to suicide. That is about 1 suicide per 40 seconds. For every suicide, there may be more than 20 who attempt suicide. For every suicide, there's more than 1,000 who suffer from a mental illness, a total of 1 billion, most commonly anxiety and depression. Suicide numbers are not even the tip of the vast iceberg of human suffering.
Being human in this broken world is tough. Suffering is normal in this world. But because of COVID-19, things are not normal anymore. Things are worse.
Around the world, we are seeing dramatic increases in the levels of distress and mental illness due to people becoming ill with COVID-19, but also because of the disruptions to daily life, stress, and isolation. A recent CDC report from the US indicated a tripling of anxiety disorders in the general population and a 4-fold increase of depressive disorders.
Among all vulnerable groups, young people seem to be struggling the most. In the age group 18 to 24, 75% reported struggling with mental health or substance abuse, and 25% reported seriously having considered suicide in the last 30 days. That is a lot of suffering. This is serious.
How many are going to die to suicide in your territory in the months ahead? How many will be on the verge of giving up? How many will suffer because of fear, despair, loneliness, and helplessness?
The United Nations says the mental health and well-being of whole societies have been severely impacted by this crisis and are a priority to be addressed urgently. Psychological distress in populations is widespread. Many people are distressed due to the immediate health impacts of the virus and the consequences of physical isolation. Mental health will remain a core concern even as countries emerge from the pandemic.
We need to act, and we need to act now. This must be a matter of utmost urgency for every leader, every pastor, every educator, every parent, every friend. We are in the midst of a mental health pandemic. We have the opportunity now to minister to the present needs of this world. If you want to reach people with present and eternal truths, we must also care for and minister to their present needs. That's what Jesus did. Let us do it too, now, together.
This initiative is not about what the GC will do. It's about what we all must do. Together, in the GC, health, youth, family, and education are working together on this. Our initial focus will be on reaching young people between 18 and 30, but we will later expand to other groups. And we pray, hope, and believe that what we do for one group may also benefit others.
We will share recommended resources on how to support mental health.
We will run a social media campaign on Instagram, Twitter, Facebook, YouTube, and other relevant platforms.
We will do webinars, interviews, and panel talks online.
You may want to do similar things. You may want to do other things. Do whatever you think is appropriate and according to the needs in your territory. And please share with us what you do so we can share with others.
The world is in crisis. People are in crisis, and we are in crisis. If we stand together and work together, we can make a difference. May God place on your heart and mind a burden to make the difference He is calling you to make. Thanks for listening. Thanks for your support. Thanks for your collaboration.